Hey everybody, welcome to another fantastic interview. Today I have with me Sheba Jones. She has agreed to let me pick her brain and interview her for all of you. I know there's nothing more exciting than seeing somebody out there doing what you want to do in any capacity. And so, Sheba, thank you very much for being with us today, for agreeing to this interview.
Thank you for having me, Jamie. I'm excited to be here.
Yeah, me too. So you guys know we tried this a few times, and so we finally connected. So we're very, very happy.
Yes. Okay.
So Sheba, you're in Arizona. Tell us a little bit about your title and your role.
I have a few different roles. One of the roles that I think your viewers might be interested in is I'm affiliated practice dental hygienist at Dignity Health Hospital Organization. It's the fifth largest hospital organization in the country. And they're very progressive. They recognize the value of having oral health as part of overall health. And so we've had an oral health department in this organization for almost 12 years now. Uh,
Wow. Now, is this a FQHC or how is this set up?
no, this is all grant funded. They don't receive any federal funding. And so it's just, yeah, that's what it is.
Wow. And so is this like a managed care organization?
Uh, yes, yes, it
Okay.
is. Um,
That's
yeah,
huge because you hear this with federally qualified healthcare clinics all the time, but you don't hear it with regular nonprofits.
yeah, yeah. So it's pretty amazing. Pretty
Yeah,
amazing.
that is amazing. So tell us a little bit about what the Arizona law is. So you're because every state has different titles for unsupervised hygienists. Tell us what you're allowed to do in Arizona.
Right. So we're an affiliated practice dental hygienist, and in Arizona, that means we are direct access providers.
Okay.
Um, we're kind of limited to underserved areas or areas that meet the certain income eligibility requirements of 200% below the poverty level. So Arizona is a big state. We have a lot of reservations, Native American reservations, where this model of dental hygiene works very well. But also Dignity Health, started as Catholic care organizations, and they've always had the mission to reach out to the indigent, to the underserved. So they've had many, many outreach programs, and the oral health department is one of those. Uh,
Wow.
yeah. So we're allowed to do all the hygiene services that any hygienist is allowed to do. We also place interim therapeutic restorations, and we do, silver diamine fluoride. All of our software is cloud-based, so we have a dentist that we're affiliated with, and we have certain standing orders that stay on file with the dental board. And so that's what we're allowed to do, what we're not allowed to do within our scope of practice. Our dentist just kind of reviews everything, reviews the patient's charts, reviews our recommendations, and may provide additional recommendations. We refer out to different partners that we have. And we see in these two specific clinics, we see children under the age of 21, who are 200% below the poverty level, and they have a lot of needs. We address those needs. Arizona has a big disparity, unfortunately, with our kiddos. And so we try to help meet those needs. That's one role that our oral health department provides.
So is that considered your mobile role then? Are you going out with a van or
No, they have clinics, community care clinics. So there's two of them in two different towns that we have. And it's like a wraparound services organization. So not only does it provide dental services, we have dental students that come in on days that we're not there to provide restorative care. We have medical, vision, dental, immunizations, food banks. They can sign up
okay,
for Medicaid. Yeah,
all under one roof?
that's right.
Gosh, so
Right.
they really copied the FQHC model
Right.
without being an FQHC because then they get paid differently. How smart.
Yeah, it is nice. It is
I
nice.
love it. So what is your role? Are you then a clinical hygienist most of the week? Or I know you mentioned that you're faculty as well.
That's right. I have adjoining roles. So I'm an adjunct faculty at Mesa Community College in Mesa, Arizona. And There I teach a couple of didactic courses, head and neck and medical emergencies. I also am in the first year clinic, and then I take students into a rotation into Dignity Health Hospital, where I'm an employee at, and we do rotations there in the intensive care unit. So it's pretty amazing. I love everything about it.
Intensive care. Wait a minute. So this is a hospital too?
Yeah.
Wow.
Dignity Health is a major hospital organization. And so they have several locations, throughout the valley. And so we take students into the intensive care unit and we provide care. Of course, before COVID, we provided care to ventilated patients on advanced airways, patients with tracheotomy tubes, patients that are ventilated, intubated. And we had a little break, a little pause because of COVID. But now we're back in there. We're on the non-COVID floors. We just started that up again a few weeks ago. So
wow, that's wonderful. So do you have a hygienist that normally does these rotations, or do they kind of rely on the students?
So right now it's sort of a new model. So we're kind of moving towards, I think, having a permanent dental hygienist in the role.
Yay.
There have been some changes in our state. One is hygienists can now be supervised under the guidance of a physician, so not just a dentist. We can,
Oh,
yeah,
shut up. I can't
yeah.
even take this. Are you serious? Oh my gosh, you just made my day. I have to write that down.
I know. And then Medicaid has made some changes in their policies so that patients in a hospital setting can receive hygiene services as well. So we're moving towards it. And I think
Wow.
having students here really shows our value to the hospital. They can see that it's cost efficient, patients have positive outcomes. It's all based on research that was done by
Exactly.
Virginia Pendergrast at St. Joseph's Hospital here in Phoenix. She did a research for her doctoral thesis on the outcomes, the cost efficiency of treating ventilated patients. She's a big dental hygiene champion, and she talked about placing those specialists, those
Yeah.
prevention specialists, in these positions to help reduce the biofilm to prevent ventilator-associated pneumonia. So that's what we're doing in the hospital. It's amazing, and I'm really happy
So
to be part of it.
fantastic. So fantastic. So are you taking our certification, our oral systemic educator
I am.
certification?
I'm very excited about it. I am.
Wonderful. Well, we are going to be so honored to have you as one of our oral systemic educators out in the world. That's
Yeah.
huge. So, do you want a different role? Tell us about what your goals are. Do you love the balance of the clinical and teaching?
I do love that balance. If something were to become available in that hospital setting, I would definitely love to be a part of that. I would love to see myself educating the medical staff more on the oral systemic link, and so I thought this was perfect, taking that oral systemic educator course. It fits right in line with what I would like to do
Yeah.
without going back, going to nursing school or doing something like that. So yeah.
That was our idea. Well, how wonderful. And you've already got a foot in the door in both places. So you're really a natural fit. Have you thought about your capstone, how you can use your capstone project to, really kind of create a place for yourself?
Yeah, I have thought about that a little bit. I think that for my capstone, I was thinking of possibly creating a course,
Yeah.
some type of course so that I can say, hey, this is the possibility, this is what could happen, and this is how I could provide value to your organization. So
Oh,
yeah.
I love it. Well, you have made my day today because I have been praying and visualizing that we are able to work under physicians for 10 years. So to hear that we've got another state that's on board, I'm so happy. So happy. And thank you very much for speaking with me today. I know that you've I'm sure inspired many hygienists to maybe take a look at whether their local hygiene school is hiring, whether they can get their foot in the door at their local healthcare department. So that's huge.
Thank you so much, Jamie. Appreciate it.
Yeah, wonderful.